Okay, hello everyone. Hello, hello. Welcome, welcome. Thank you guys for joining. Okay,
How
we
are you?
want to get started. We're good. We're good. We want to get started again. Welcome to everyone. Pastor, I'll allow you to give them an official welcome.
Okay. So everybody's here. Good evening, everyone. My name is Steve Epting. I'm the pastor at Hope Community Church, and I'm excited about being a part of this definitely needed conversation. I'm also excited because I know one of the panelists. I've been knowing them all my life, and excited to hear and be a part of the conversation. Um, if I could just give just a real brief, since the pandemic has begun, um, as a pastor, as a person who ministers, as a regular person, we're still trying to live our lives, and I did all that I could do to stay safe, what I knew to stay safe. Um, and I thought I was doing a great job until I got COVID from someone um, who was close to me, and man, so many emotions began to come forth, as well as just needing to make decisions, going through the virus, and it was so many questions I could not answer. So many people gave me information that was kind of overwhelming, and we just thought it was great to take this opportunity to discuss with those who may still be um, who needs information about this disease, as well as people who've had it and what they may be still be what they still may be dealing with. And so excited to have our panelists here. I welcome you also with those who are on the line at this point. We welcome you as well. Susie, I just wanted to make sure, was this being taped?
Yes.
Uh, and so we will have an opportunity to look at this again for individuals who may miss out on today. But just wanted to thank everyone for being a part of this discussion. And I turn it back to you, Susie. Thank you.
Thank you. Thank you. Now I'd like to introduce our panelists, and I'm going to start with Jasmine Hall, who is an epidemiologist who is a part of Michigan State University, and she's also a researcher there, and she could talk a little more about that. I also have Dr. Lisa Green, who is the CEO and co-founder of the Family Christian Health Center. Dr. LaVerne Burns is also on the line. She's the medical director and director of clinical operations for Family Christian Health Center. And Mia Cross, who's an RN at RN and director of community health programs for Family Christian Health Center. So, welcome, ladies, and thank you guys for your time, your expertise, and your willingness to inform, educate, and help us fight this. So, thank you so much for that. Now, what I'm going to do, guys, I'm going to start a poll, and I would like you to go through the poll as we start our presentation. And we're going to start the presentation with Jasmine Cross, our epidemiologist, who's going to give us some information as relates to us.
Thank you. I'm glad to be joining you all here today from Flint, which is my home. Um, and so it's really important to know how we're doing with the stats around COVID. So I'll share a little bit about the cases and some of the deaths that have been happening in Chicago, more broadly in Illinois, and then in the United States. I'm also really grateful that we have a few people who will share their kind of individual experiences, because it's so easy to think about people as numbers, as we keep hearing these counts, but these are really people we know, and it's a lot easier to do the things we need to do when we can put the humanity back into it. Um, so I'll start off with Chicago. Um, so as of midnight, there were 218,015 cases and unfortunately 4,361 deaths. Of those 218,000 cases, 36,890 were African American, with 1,684 deaths. In the state of Illinois, we've exceeded the 1 million mark, so 1,033,526 cases, with 17,000 deaths. 98% have recovered, which just means that after 42 days, after a positive COVID test, you are still alive. In long-term care facilities throughout the state, we've seen 67,407 cases and 8,670 deaths. In African Americans in the state, 98,820, with unfortunately 3,236 deaths. The positivity rate in Illinois, and positivity rate is the percentage of tests that come back positive out of all the tests that are done. And remember, early on, there were fewer tests available, so it would have been higher. But the positivity rate also helps us understand approximately the current amount of transmission of COVID in the community, as well as whether or not we're doing enough testing. So in late March, the African American positivity rate was 48%, with Asian, white, and Hispanic people at 27, 24, and 47% respectively. And as of yesterday, the African American positivity rate fell to 9%, with 8% in Asians, 12% in white people, and 19% in Hispanic people. In the United States, more broadly, we've seen 22.7 million cases with 379,000 deaths, unfortunately. In African Americans, we're seeing 1.4 times the number of cases, 3.7 times the number of hospitalizations, and 2.8 times the number of deaths that we see in the white community. Fortunately, we do have hope now that this virus will not continue to ravage our communities, as we know we suffer disproportionately from these underlying health conditions that are driven by systemic racism. So this vaccine really does represent kind of a hopeful turning point globally in this pandemic, but especially in our community.
Exactly, numbers. Thank you, Jazz. Was that it for you, Jasmine?
Mhm. Yep.
Thank you so much. Thank you so much. So that just gives you kind of a picture of where we are, guys, in our own area of the world, own town. A lot of times we get the information on the news and it's global information, but this is really curtailed right to us, streamlined to where we are. So what I'd like to do right now is have Mia talk to us a little bit about what is COVID.
Hi, good evening, everyone. So COVID-19 is the disease caused by a new coronavirus called SARS-CoV-2. WHO, the World Health Organization, first learned of the new virus on December 13, 2019, following a report of a cluster of cases of viral pneumonia in Wuhan, the People's Republic of China. In February the 11th of 2020, WHO announced an official name for the novel coronavirus, meaning a new coronavirus that has not been previously identified, as coronavirus disease 2019, commonly known as COVID-19. It is not the same coronaviruses that commonly circulate among humans and cause mild illness like the common cold. The virus that is caused by COVID-19 most commonly spreads between people who are in close contact with one another within less than 6 feet. It's spread through respiratory droplets or small particles, such as those in aerosols, or produced from infected people when they cough, they sneeze, they sing, they talk, or they breathe. The particles can be inhaled into the nose, the mouth, and the airway, and your lungs. It is thought that this is the main way that the virus can be spread. Droplets also can land on the surface And when you touch them, if you then touch your face or your mouth or your eyes, then you can also catch COVID-19 in that way also. There's growing evidence that the droplets and the airborne particles can remain suspended in the air and be breathed in by others and travel farther than 6 feet. In general indoor environment without good ventilation, it can increase your risk. Some of the symptoms from COVID-19 can appear in 2 to 14 days. So people that may have COVID-19 can have a fever or chills, a cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, a new loss of taste or smell, sore throat, congestion, a runny nose, nausea, vomiting, and diarrhea. Some of these symptoms have been expanded. In the beginning, it used to only be a cough, a shortness of breath, and fever, but as time has gone on, people have developed more symptoms that they are now related to COVID-19. Thank you.
Thank you. Thank you. Okay, so we want to bring it even closer to home for us now that we know a little more what COVID is and what it does and where it is in our community and the numbers. We want to talk to some of the people that we know personally in-house, a lot of us. And I'm going to ask Roy if he will, I'm going to link you in and have you just kind of share with us your experience having had COVID. Are you there?
Hello?
Yes, there you are.
Okay. All right. Yes, hello everybody. My name is Roy Harris, and I was contracted with COVID back in April of last year, April the 7th. Actually, I was home care for my auntie, which she had gotten it also and was affected by it. Unfortunately, she expired actually on Easter. So the symptoms that I started to have and develop was when I couldn't taste food. I was in excruciating pain, and it just got to the point where I like my family and friends, where I ended up going to the hospital, which is Christ Hospital on the south side, and we went through the emergency room. All my vitals showing signs.
Roy, you kind of breaking up.
It was COVID-related. So at first when they tested me, it came out negative. So is that better? Is that better? Is that better?
Yeah, we hear you, Roy. We hear you.
Hello? Is it okay? So they end up admitting me into the hospital, and when they did that, like I said, it came back negative. So after that, the doctor was insisting that I still exemplified, symptoms within like 24 hours, and I ended up having to have had COVID. And it got to the point my breathing was very shallow. I was like, maybe 50% of breathing. I had no appetite whatsoever. I was very weak. So they immediately, took me up to the COVID unit and, started treating me. So after that, staying in the hospital for 2 weeks, I still, I was building some of my strength up, but, I was still on the oxygen machine for some time. And actually, that was helping me to breathe, but, I had to go through therapy of walking again and building my strength up. So that was a very hard challenge for me. So after then, the effects that I have now, I still feel like my strength is not back at 100%. I try to do what I can do. If I can't do it, I don't overexert myself, but I mean, that's the most of the effect that I feel, because I feel like, that was just something to me that I couldn't, it just like I couldn't shake it. And, I tried to push myself, to do stuff. Being overly fatigued would be one of the things that I'm still dealing with as of right now. And, I just still feel like I'm limited. So yeah, that was a tumultuous time for me going through that situation, because, the doctor wanted to put me on a ventilator, and I just railed against that because I felt like, I didn't want to go on a ventilator. I felt like maybe if I had of, I wouldn't be here. But, that was a very scary time. And I didn't want to risk that, I felt like I just wanted to be on the oxygen machine and, stay on there until, I feel like my breathing come back up to par. And I just insisted on that.
Okay, thank you, Roy.
And, like I said,
I'm sorry. Thank you, Roy. We got a couple more pounds we got to get to, but thank you so much for sharing. Thank you so much. Okay, now I'm going to move on to Keisha. I'm going to include you, and can you please share your experience? And panelists, if you guys can kind of give us a quick summary of how you felt and what you went through when you contracted the virus, that will help us maximize our time. Thank you.
Sure. Can you guys hear me?
Yes.
Hi, everyone. My experience was pretty, I mean, for me, it was rough because I was someone that never got sick, not even the common cold. So the weekend of October 23rd, I decided to go and do brunch with some friends. And, I thought that it would be okay, seeing as though the entire place was socially distanced and we all wore our masks, and we thought that we were being safe, especially since we were outdoors. But obviously that wasn't the case, because with that being on the 24th, by around the evening of the 26th, which was that following Monday, I started to feel tired that night. Didn't know why. I woke up the next day and I woke up with like the worst headache I had ever experienced, and the air seemed to smell a little stale, and my body started to feel just a little tender. And then and so I sat with it for a little while because I'm thinking, okay, maybe I just slept, I slept wrong, but progressively throughout the day it got worse. And so the next day I woke up with those same symptoms, but they were a little worse than they were the day before. So that's when I decided I needed to go in, because I knew I had never felt anything like it before. Went in, I got tested, and they did a rapid test, and that test did come back negative. So so I came home and I treated it as if, maybe this was the first time that I had a cold. But later that day, it started getting worse. So the next day I decided to go back, and I got another rapid test, and that's when it came back positive. When that test came back positive, not only did I have the body aches and the headaches and the fatigue, but I also started having shortness of breath. I couldn't smell anything. I mean, there was just like a stale smell. And then my taste buds were way off. And it took me a little while to recover from it. I would say I wasn't really starting to feel like myself again until maybe about 8 days in. But once I did start feeling better, I didn't go outside immediately. But even to this day, I still struggle with walking up a set of stairs and being able to maintain my breath. But I definitely was among that group that felt invincible. I had never been sick before. I had been out a few times before that and hadn't contracted it. I wore my mask all the time, and I just, I think I really did take it for granted. But that experience definitely sat me down.
Thank you so much, and thank you for your honesty and your transparency. Thank you. Okay, we're gonna have one more panelist, Maurice LaVerne. If you can join us and share your experience. Are you there? Maurice? Okay, so we'll move on. And Bernice Porter, are you on the line? We're gonna move to her and we'll have Bernice Porter share her experience. Are you there? Bernice Porter?
She's muted.
Are they muted?
Yeah, she's muted. Mom?
Yes, I'm here.
Okay. Okay, you want to share your experience?
Oh, yes. How I contracted the virus, I do not know until this day how I contracted it, but I contracted on April the 2nd. And I really didn't know what was going on because at first I didn't feel sick, but I know I was tired. And after that, a few hours, my oxygen level started to drop and I got extremely short of breath and I was fading in and out of consciousness. And I was extremely weak and seemed confused. And that was when I knew I had to get to the emergency room. So after getting to the emergency room and was checked in there, the next day they found out that I was positive. And I was extremely weak and I was unable to walk without an assistant. And my joints were sore. And it also, I didn't know it until later, it affected my kidneys. And my doctor did not want me to go on the ventilator because I have so many pre-existing conditions. I have asthma, COPD, congestive heart failure, and high blood pressure. And he thought if I go on the ventilator, he said it really wasn't looking good for me. And if I went on the ventilator, he wasn't sure that I would make it. I said, well, I'll just take that chance. I won't go on the ventilator. So I didn't go on the ventilator, but I continued to be short of breath and have to have the oxygen. Was still fatigued and weak. And after 2 days, I came home. And coming home with oxygen, which I still have to use from time to time now. And I have to constantly, daily monitor my blood pressure. I have to daily check my oxygen. And I have to put that in every day to telehealth. And telehealth conversates with me every day, the nurse, to make sure that I'm on target. And I have to take my medication regular. And I'm trying to get back now into my regular routine. But overall, I think I'm doing good. I try and maintain a healthy diet and exercise and do my meds as they are prescribed. And I just try to fight hard every day to make sure that I'm doing as much as I can do, but I don't push myself. But I try to always find time it makes me feel better when I can encourage others and do something for others. So I just have to include that in my daily routine. But now I feel like I'm getting back to some of the things that I really do enjoy. But I tell you, it is no joke. It hit me out of nowhere, and I had tried to be also careful and ended up with it. And it left some lasting effects, and it will affect you mentally. And I have to fight that part too. But I'm really thankful that I'm still here, because my doctor just looked me in the face and told me, he said, I've always been honest with you. He said, I'm going to be honest. He said, you want the truth? I said, yeah. He said, it's just really not looking good. But I am still here, and I think I'm doing good.
Yes, I would concur. Thank you, Mom, Miss Porter. Thank you. Okay, now I'm trying to be professional, guys. That's my mom. I'm sorry. I'm a little biased. Okay, I'm going to go on. We have, I just got it. Maurice did tell me that they were on, so they should be together now. So we're going to go and pick him up. And he's our last speaker who has contracted the virus. Okay, Reese. Maurice?
Good evening, everyone. Can they hear us?
Yes, we can hear you.
Good evening, everyone. I contracted it May 2nd. I was hospitalized for almost a month. I went in basically with a high fever, breathing issues, no appetite, dehydrated. To this day, I'm still here, but I do have slight problems, breathing problems, lack of energy still. I push myself still at work. I try to do my exercising. I do a lot of walking around the job, but I'm constantly shuffling sometimes for my breathing issues. I do still have lack of energy, but like Ms. Porter said, she's not pushing herself, but I try to push myself. I don't have to take my medicine. I don't have any medicine to take. I do have breathing exercises that I do have to take, and I have to constantly monitor my temperature, my oxygen. I do that a lot of work at work. But by the grace of God, I'm still here.
Yeah. He was ventilated. He actually was ventilated for only like 4 days, which, they thought he started doing really bad, and then he just all of a sudden just, turned around really quickly. So the hospital was they were very pleased about that. The oxygen, I think he was on like 15, 20 liters of oxygen. Yeah, so the oxygen was really gone down. And so I think it affected a lot too of just a kind of a delay. It's kind of been a little, to me, just a little delayed. It's just not thinking as quick sometimes. So I think it affected his cognitive ability a little bit.
Okay. Thank you. Thank you guys so much for sharing. And we wanted to have people that we could touch and that we knew personally that had contracted this virus, and then to hear some of the differences and some of the different effects and lasting effects and ending results, and then some of the similarities. And so we'll be able to talk a little more about that as we move now into the best practices and preventions. And then we're going to talk a little bit about the mental health aspect of this as well. And that's going to be a tag team with our entire panelists. So you guys can pick and choose who wants to start. Let's get in it.
This is Dr. Barnes. I'll go ahead and get started. Just thinking about some of the best practices and as far as prevention. First and foremost is to make sure that you are being cautious and safe, meaning that you do wear your face mask. You don't do any unnecessary social activities that will put you at risk. And so when we talk about our face masks, we talk about proper hand washing, we talk about social distancing, at least 6 feet. But one of the other things that's just as equally as important is your own mental health as well as your physical health. And so for those people who, we've heard some people already, some of your parishioners come on board and say that, I've been healthy and this came out of nowhere. We see that the vid is what I call it. The vid don't discriminate. It don't care if you young, old, white, black, orange, or purple. It's going to attack whomsoever will, if someone ever is taking a deep breath in and the vid is around, it just attaches to you. So one of the things we can do is to keep ourselves physically healthy, by having a regimen of exercising, with the recommendation of 30 to 60 minutes, 3 to 5 days a week. Trying to make sure that there is some type of exercise going on. We saw an increase in the amount of people riding bicycles during COVID, running during COVID, although they were just doing it with their select group. But exercise didn't stop because of COVID. We actually were still doing it. The other thing is to make sure that whatever type of exercise it is, you're just consistent in doing it. Even if you're only able to go out and walk 10 minutes or your treadmill or sit at home and walk away the pounds, from a video or whatever. It doesn't matter. It's just a matter of being consistent. The other thing is to make sure that, we always talk about some of the natural remedies. We know about some of the medical things that if you do contract COVID, that doctors are the treatment modality, but having a healthy dose of vitamin C. I always tell people, to take your vitamin C tablets, especially during the winter months, it's good to build up your immune system. Research has found that between 30 and 100 milligrams of vitamin D, if your level is between 30 and 40, that helps to ward off the effects of even the common cold as well as COVID. So we recommend that you at least take your vitamin D daily, and then a multivitamin. There's some natural herbs that people use, the oregano oil, elderberry. So there are some different things that, echinacea, which is a blood purifier. So it's a tablet as well as a tea that you can use. So those are some of the things that you can use for your physical body, but then mentally, just having a regular regimen of being able to ward off the enemy on every hand. You'll be surprised that, and I think you guys won't be surprised that the enemy like to come in and figure out a way to do what? Steal, kill, and destroy that which God has already created. And the way that he does that is that he gets into our minds and tell us that if we get COVID, that's it. And my pastor has a saying that he uses all the time: it's always better to be prayerful, to use wisdom, but never fearful. And in doing that, we can ward off COVID, some of the effects of COVID, and just continue to function. And the last best practice I'm going to mention is, I know the vaccine is here. The vaccine is out. I have one that have taken both doses of the vaccine, and I can tell you that first dose didn't really bother me. It gave me a sore arm the way that the flu shot does or your tetanus shot does. Really didn't have any effect. I got my second dose, and again, I got the sore arm again. And the second dose, I probably got a little bit of a mild headache, and I have to assess myself when I start to get headaches. Is it the vaccine, or did I not drink enough water, which should be half your body weight in ounces, which is another thing to ward off disease and disorder. So I just wanted to share those things with you.
And the one thing, this is Dr. Green, is the diet. When she talked about, the exercise, COVID right now, smoking used to be the biggest risk factor. And so now we begin to look at the new risk factor after COVID is going to be sitting. And that is because we sit now more than we ever have before. And when we sit, we are also eating. I tell people, years ago, especially in our communities, Black people ate fatback, bacon, eggs, and ham. They snuffed tobacco, they drank grain alcohol, they had a little sugar, they lived to almost 100 years old, right? They walked everywhere and they grew their own food. They even had their own smoke houses and things like that. We don't do any of that. And so with COVID, we are now doing Instacart. We are now eating out more in some aspects than we ever have before. And no matter what your body has to fight, there's two things: what you eat and the amount of sleep is major for people, right? And going to bed and getting sleep and rest are two different things. Getting rest allows your body, when you go to sleep, that's when your immune system is able to fight and it's repairing things. During the day, it's up, it's working, you have to, you're cooking, you're cleaning, you're doing your regular job. So the body is moving, right? But it is at nighttime when the immune system is really lining things up to repair and to heal. So that is extremely important for people. And then being able to, we all, start these regimens at the first of the year about what we're going to eat, how we're going to cut off, and things like that. But you have to be really realistic about what it is that your body is telling you as far as your diet is concerned. We know that a low carb diet, but you call it the keto, you call it the Atkins, you call it whatever you want. It means when we eat way more foods that we don't necessarily need, right? So it is that carbs, which is and all carbs are not bad, but you have to be able to have a balance of what you eat. That is, 3 to 4 servings of fruits and vegetables a day. That is the servings of, having your meat portions that are lean. And if you're going to eat fried foods, you limit those fried foods. We know a lot of what we have to do, but it is the time to do that, which means that is meal prepping, that is being able to plan, and then within a range that we can afford, right? How do you balance that out? We now have access to internet and information so fast that you don't necessarily have to go into the doctor's office or go see a nutritionist, but you do that in conjunction with. But what you can do is begin to really sit down as a family. With all the negative things that happened with COVID, one of the positive things that has happened is families now are talking to each other more than they have been. And so being able to plan as a family what it is you're going to eat. And if someone's single, okay, how do I match that out, right? For me, what does this look like? It's very easy to Instacart. It's very easy to Grubhub and Uber Eats. We have all of those facets, but what are you choosing when you push send? That's what we have to really be able to be mindful of. And a lot of times food for us becomes a comfort. You've had a long day, you've had a bad day. I know for me, it used to be Harold's French fries with mild sauce, right? No matter what happened, if I got to order fries with Harold's mild sauce, I was good. And so, but was that helpful for me? Absolutely not. And it's short-lived. So you want to be able to ensure that the food that you eat is allowing your own immune system, whether you're taking vitamin D, elderberry, or anything else, that your immune system is always in a position that it's equipped to fight. So that's why what we've been saying over the years about the importance of eating a balanced diet is really not an option for us now. And so we have to make sure that we prioritize that individually for our families and collectively. And I think this venue is a great opportunity. What better, and I commend, the pastor, and Suzette for putting us together. We don't always know the people that we hear on television, but you know each other. So taking the information that you have now and empowering yourself with knowledge of the virus, with knowledge of the things to eat, to not eat, that's how you kind of combat this.
Thank you so much. Anyone else? Jasmine, and also there's a question, guys, in the chat. In the Q&A, there's a question.
Thank you. Yeah, I'd like to jump in and first just adding on to the physical health piece and kind of protecting yourself from COVID. We have these bubbles, and we need to make sure, these are the only people that we're, really engaging with, and especially the only ones we're engaging with our masks off. If that's the level of engagement that you're having with your bubble. And that means, you're not adding people to the bubble, and you're not going to restaurants and things like that. And also we want to make sure we wear masks even indoors. I know, in the summer people were outside and it was a little easier to social distance, but inside we need to make sure we're wearing masks. If you're, in a photo with somebody who doesn't live in your house, you want to still have that mask on. Let that be the, I don't know, reminder of this time, but keep the masks on. As far as public health, some of the actions even required for public health, like social distancing, those can make us feel, lonely or isolated, or kind of increase our stress and anxiety. So, I mean, of course, they're necessary to do to prevent the spread, but we need to make sure we're coping with stress in healthy ways. Like that way, the people we care about, our community, is a lot stronger. One way that I cope, as someone who lives alone and doesn't live as close to some of my loved ones, I'll schedule a stand-in check-in time just to chat or cook together. Like I think Dr. Green was saying, or even work out. I have a friend who just had a baby, and she's ready to go. She's like, I'm trying to get back, get her summer body ready. And then another thing is, it's nice to be equipped with information about about COVID, about the pandemic, but sometimes we need to know when to kind of take a pause, whether that's taking a pause from social media, or turning the news off a little bit. Of course you want to stay informed, but making sure we have some kind of limits. In addition to that, we do want to be equipped with the knowledge that we need to actually keep ourselves safe, and resources that can help us in a crisis. I was looking at the Chicago COVID resources finder at covid.citybureau.org, and they have food resources and telehealth resources, unemployment, as well as housing resources. And this can help you feel more confident that you can cope with some of the hurdles of this pandemic. I mean, another thing, we're in a kind of church setting, and you want to reach out, to your spiritual leader, to your faith leaders, and then also reach out to mental health professionals. If you really feel like, okay, I need to talk to someone, that was me. I looked on Psychology Today. I said, let me find somebody who takes my insurance, who works with African Americans, and who is licensed to practice in my state. But I also know therapyforblackgirls.com, therapyforblackmen.com. They're right there, they're available. And then additionally, in addition to therapy, just like many people have said, you want to keep that self-care up. And it's not always bubble baths. Sometimes that's getting your 8 hours in, or eating that healthy meal where your mental health is going to do well because you're eating, healthy food. Getting like physical activity, like we've been hearing about, maybe meditating, stretching. Even if you don't do a full-on workout, just move your body a little bit. Because again, our mental health is so important for our overall health, for our well-being. So we really do want to take care of it.
I'll answer the question about can you get COVID twice? Originally when we thought with COVID that you have antibodies, right? And those antibodies would last for a long period of time. We're realizing now that some people's antibodies last a couple of weeks, some people's last a couple of months, we don't know. And in fact, right now, I have someone who was young, otherwise healthy, didn't think she could get COVID, and tested positive for COVID, got really sick, lost her taste, everything. And her question to God was like, okay, either take me because I must be getting ready to die. This is it. And she recovered and did well and went back to work. She was off work and ensured that she was negative before she went back to work. She goes back to work, and 3 weeks in, 20 people at her job contracted COVID, and she was one of those. And the side effects now are much worse than the first. And we don't have the rhyme or reason, why did she get it again? Why is she even sicker now than she was the first time? She doesn't have asthma. She doesn't have any other health issues. She's under 50 years old. She's not the predictable person that even if you would see someone that would get it again, she's young. And how does that happen? And so to answer your question, yes, you can get it again. But again, we don't know why or who, is predisposed to that. And the one thing that Jasmine mentioned, finally in our communities, it's okay to say we need mental health issues, right? For a long time, we, sent people to Tinley Park, if you're from Chicago, and they went to the crazy house. And you know what? Grace of God, there go I. And so there are a lot of people that deal with mental health issues that are just like people that deal with high blood pressure and diabetes. We don't know why the imbalance happens. And we do know for sure there's a group of people who have post-COVID who are now struggling with anxiety, and they never had anxiety before. So is it the COVID? Is it the fact that they had COVID and then they're nervous of each piece? Or has something happened within the imbalance of the hormones that's creating a different level of anxiety for people? And so it is definitely important to then reach out to medical professionals to be able to get that support. And it's much easier than it was before, because the stigmas and the label that's going along with that, those bars are now coming down.
Dr. LaVerne, can you, I see you answer the question, but can you just talk a little bit about that? Your response, Dr. LaVerne?
Okay, yeah, I think I essentially said the same thing that Dr. Green said about being able to get it. And there are like different, we saw something within the last week and a half or so about the different strands that may be out there, especially seen in Europe. So there is a possibility that, you can get it and you may get a different strand. So I think the important part of it is to know that you definitely, you may have antibodies, but, the science is too new with COVID to definitively say that you cannot get it again within the 90 days, of actually having it. So you definitely could. The other thing, there was another question I think about if you had COVID, if you should get the vaccine. And so, it is recommended that you do get it, but because you do potentially have antibodies that are prevalent for the first 90 days, the recommendation is to wait until after that 90 days is up before you get the vaccine.
Okay. Thank you. And I just want to let you guys know, please, if you have questions, please put your questions in the chat or in the Q&A, and we'll pull them and we can answer them that way and keep rotating in our conversation so we can really maximize our time. And I don't really want to cut that off, but we will move on to the testing, the trial, and the vaccine. We kind of talked a little bit about that. We also want to talk about that immune system.
Hi, this is me. I can start out with the testing just to let people know that there's still a lot of testing that's still available out there. There's the nasopharyngeal swab, which is the longer swab, which initially we started with. And then now currently there is a shorter swab that's the same size as a Q-tip. So it's less invasive, less painful, and it's still 95% effective, the same as the nasopharyngeal swab. And then now we've moved to a saliva test as well, which is again 95% effective. It's just another method, because what people didn't know about the swab is that there was a shortage on the swab. So they had to come up with another method of doing the test, because the swabs are actually made in China. And so that created the shortage as China, more people there got sick, and then it came across here to the United States. Then it was harder and harder to get that equipment to do the testing, because some people were concerned, why did they switch the type of swab and the method of testing? And that was some of the reasons, because of the shortages, they had to come up with other methods. They're just as effective. So any test that you get, you're gonna get the right results.
I'm sorry, I was muted. There's another question about the vaccine. If you get the vaccine, will it combat the new strand? Can someone speak to that?
So I guess the question is, will with the curing vaccine combat the new strands that may come up? And that information is unknown at this time. And so we can't definitively speak to that to say that the new strands are actually covered under the curing vaccine. They have been in the works with all 3 vaccines that have been approved for some time, even before we knew about the strain, the mutation with the strand. So I'm not sure 100% if anyone has that answer on the line.
Okay, thank
And,
you.
and it's expected that there's always going to get a strain. Different strains. The longer a virus is around, they learn. I mean, they're smart, and they're like, okay, wait a minute, let me just move a different way. And so that's just the genetic nature of viruses. And so they predict that there's going to be, in some of the the research, of course, they predict and anticipate that. But the exact science behind it, like Dr. Barnes is saying, is not 100% known right now.
Okay, thank you. Okay, any more comments, guys, about the vaccine? Or did we talk about the immune system or the compromised immune systems?
Okay, I think, we can say that if you have an immunocompromised system, you have a lot of comorbidities, a lot of disease, a lot of different types of medical conditions, then, you are at increased risk for getting that, as well as being aged. I think the age is lower than 65, but it is 65 and, and above with a lot of different medical conditions. So you want to make sure that your system is built up. The question about whether or not, someone with comorbidities or a lot of medical conditions, if they should get the vaccine, I think so. I mean, I think it's obvious that our particular community that have a lot of conditions are the ones that are dying the quickest from COVID. And so just like with the flu vaccine, who, if you don't get it, if you have increased risk and you do get the flu, it's worse for you because you are immunocompromised. And so the recommendation is always going to be that you should get the vaccine. At this particular point in time, if there are some diseases that are contraindicated for the vaccines, for instance, Guillain-Barré syndrome, some of the immunocompromised states from an autoimmune perspective. So those things, in consideration with your primary care physician, you should make decisions about whether or not you should obtain that vaccine when it does become available for the public.
Thank you.
And I think there's a question in the chat that's asking, what's the likelihood of catching the virus now versus a year ago? And I think the chances of catching it now versus a year ago is, if you take your mask off, your risk of catching the virus is still high, the same as it was in the beginning. It's the same risk. So that's why everybody needs to keep on your mask. You need to social distance. You need to wipe down those highly touched surfaces frequently. That's the importance of those, so that you don't catch it.
Right. And so I think, Jasmine, you may want to talk about, to answer that too, the herd immunity. And that's what we were talking about, to kind of, you've heard that term, herd immunity, and what does that mean? And I think until we get there, even with the vaccine, you have to still wear a mask. You have to still social distance. So maybe you want to explain what the herd immunity is.
Absolutely. And I'll start off with the kind of the vaccine rollout. And I know it changed a little bit with the news today, but the Department of Public Health, they kind of had 2 major phases of rolling out the vaccine to get us closer to herd immunity. So the first phase is right now, where we kind of have limited supplies of the vaccine, and the second phase is when when we have enough for everyone. And then the first phase is broken down into A, B, and C. So in phase 1A, which is going to be around 850,000 Illinois residents, these are people that work in healthcare in and out of hospitals, long-term care facilities, congregate care residents, and employees. Sorry, this poll just popped up. Phase 1B, this is where we are actually starting to be now, where people 65 plus are going to get the vaccine. Phase 1B also includes frontline essential workers and inmates, and these frontline workers, are inclusive of first responders, corrections officers, people working in food and agriculture, postal services, manufacturing, grocery stores, public transit, K-12 education, child care workers, shelters, and adult daycare. So really people who we really would have to interact with to essentially, if they're vaccinated, it drives community transmission down a little bit. Phase 1C, which is going to be about 4 million Illinois residents, this is going to include people who are under 65, so 16 to 64, who are high risk, having one of the underlying conditions. Other essential workers like transportation and logistics workers, food service, housing, finance, bank tellers, IT, energy, media people, legal people, public safety, public health workers, people like that. And then once we get to phase 2, this is when we have enough vaccine that has been produced so that whoever wants it can get it regardless of age, employment status, underlying conditions. And once we get to phase 2, this is where the herd immunity can, that's when we're much closer, because that means anybody can get the vaccine and we can dramatically reduce transmission. And herd immunity is really when enough people become immune to a disease to make it spread very unlikely. So as a result, everyone is protected, even those who themselves are not immune, just because everyone around you is immune to the virus. Things like measles, mumps, polio, chickenpox. These are examples of some of the other infectious diseases that we know about that are very common, but they're rare now in the United States because of vaccines. They helped establish essentially herd immunity. We do sometimes see outbreaks of vaccine preventable diseases in communities where there's lower coverage. So back in 2019, there was a measles outbreak, for example, at Disneyland. And in the community, there was low vaccination rates. And then the point really is to get about 70% of the population immunized. And of course, prioritizing those at highest risk of complications or of spreading it, similar to what I was talking about in phase 1. I also want to share, and we talked about this on our pre-call, but the difference between efficacy and effectiveness, because efficacy is really like how well the vaccine works under ideal conditions. So in the trials, and so, we see 95% for Pfizer, 94.5% for Moderna, and a vaccine with an efficacy of 90%, for example, in a trial, that doesn't mean 90% of people will not have COVID and 10% will. It means that there was a 90% reduction in the cases. So in the vaccinated group compared to the unvaccinated group. And effectiveness, on the other hand, is what happens in the real world. So in the trials, people are usually not able to join trials if they have underlying conditions, or there's sometimes certain age restrictions on trial, so it doesn't always translate to what happens in the real world. And that's something I think we really want to be mindful of, because everybody's like, 95%, but most vaccines are in that 40 to 50% efficacy, and then when they get 40 to 50% effective in the actual real world, like our flu vaccines, for example. I think they're around 40 to 60, but they still save thousands of lives. So by the time we have the majority of the population vaccinated, community transmission can be essentially really, really low, so that even those who are hesitant to take the vaccine or have underlying conditions are still protected by what we do. I know some of the doctors on the call have already had a chance to get vaccinated, and the take home is really, we take the vaccine to protect ourselves, but also those in our homes, in our networks, our communities, and especially, again, those who cannot take the vaccine.
Right. I think that's a good point. I think for those that are fearful, those that take it aren't taking it just for themselves. They're taking those for those that are fearful. Right. So that's the bigger take home from this, is that somebody has to do something. Right. And so it's that concept, I am my brother's keeper. But at the same time, we live in a world with, we've been discussing Black Lives Matter. The Tuskegee, experiment, what happened before. And I think we've heard the word mRNA and think that, it's going to then change my DNA. And then is there a computer chip in it? When we brought about vaccines before, when polio first started, they had to do something. When TB was an issue years ago, but back when TB and polio came out, they didn't have Instagram, Twitter, Facebook, right? So they didn't have all of that. We didn't have the internet access of information that we have now. And so I think because there is some unknown, there is some distrust, but because if no one got the vaccine, and we did nothing and allow those people to still continue to get, then you are still continue to roll the dice. But I think we forget sometimes that there are people who got COVID and completely fine, but there are other people who that wasn't their case, right? And so how do we then, as a nation, as a community, then educate, best possible scenario of making choices, right? And so what you want to do is don't let the internet make the choice for you. Let your wisdom, talking to a provider, the medical professional with you, let that be how you make your informed choice. And there are people who don't necessarily that window, right, who can't get the vaccine. But when we look, and so some people looked earlier and they said, well, the majority of people that were dying are over 65 anyway. Well, who said life ends at 65? Right? Those lives still matter also. And so we have to be able to begin to pull back and get informed information so that way we are equipped to be able to make wise decisions. And so I think, and it's only normal, right, to be fearful, because if you look at it, look how many doctors are still, all the doctors didn't sign up to say, okay, the vaccine is out tomorrow, sign me up. Everybody didn't. So people had questions, they had concerns. So now any physician that I know or nurse, a medical professional, they begin to get some data and some research and understanding before they actually took the vaccine. I mean, the same thing myself. And at the last minute, I'm like, are you sure? Are you not? Because we're the medical professional people, if you realize, we're also our mothers, our sons, our daughters, we're the neighbors, we're everybody else, just like everybody else is, if you think about that, right? Our occupation is a physician, a nurse, a lab technician. But when we come home to our family members. And so we have to be able to really realize the importance of why we are doing this, the importance of I am my brother's keeper, the importance of I'm still wearing a mask. I can remember I came home for my birthday and the kids had a cake for me and I got ready to blow the candles out. And they were like, I know you don't think you're going to take that mask off, blow your candles off for your birthday, because they're like, you're our biggest risk. And I was like, absolutely. My point being, I guess the take home message is we've given a lot of information tonight, but do like you are doing. Ask questions, get the right information so that you can get that broken down. Is there a computer chip that's going to be in there? Is it going to affect people that are pregnant? Because that was the one thing in the study, there were no women that were pregnant, right? They didn't go after pregnant women, but there were 4 women that they found out that were actually pregnant that still did okay. But do we vaccinate pregnant women right now? Absolutely no. That's a decision that has to be made for the patient and the provider, right, to make that decision. But again, it's really equipping yourselves with as much knowledge as possible.
Yes, and I wanted to jump back in on the herd immunity thing, because you said something really important. We are our brother and our sister's keeper, and life doesn't end at age 65. So I've heard several people, millennials my age, saying, well, can't we just let everybody get COVID and then we're done with it? And no. So there are two primary ways to achieve herd immunity. Of course, we have infection, and then we have vaccination. And because of even in young people, because of the way the harsh case outcomes, the harsh death outcomes that come along with COVID, this is not really ethical or effective to reach herd immunity. Too many people will die, young people and those who we interact with. And so once again, getting vaccinated, keeping ourselves safe with masks and social distancing is not just for us.
Right.
Dr. Barnes, you want to answer? There's a question in the chat that talks about what's happening. Why do some people get exposed and they tend not to get it? Right? What happens to someone who's been in an environment and some people get it, but some people don't?
Yeah, so that's interesting because you do have people who have been exposed who, who do receive it. I mean, who are exposed but don't necessarily contract the actual disease itself. That has to do with the immune system. I'm not quite sure, and I'm not sure, Dr. Green, if you may be able to expound on it. But we have it a lot. People who are exposed to the flu. Not everybody get the flu when they are exposed to it. And then there's different level based on your immune system and based on your status within your immune system, whether or not you're going to get a certain level of disease. Meaning, when I get, if I get exposed to the flu, the way that I express that infection may be different from somebody else expressing that infection based on their immune system. So not everybody is the same, but we do know that having some exposure to the virus, that people can have what's called they are positive, they are exposed, but they don't exemplify the symptoms. And so that's where the biggest concern has been, is that you contract the disease, but you don't express the actual disease within your symptoms, but in your DNA, you have been exposed to it. And as a result, you then test positive for it. And so those people who don't realize they have it are the ones who then tend to spread it to those who may be more immunocompromised, or those within their households, and that's how people are getting it. We're finding out that a lot of people are not getting COVID because they actually go to work every day. They get COVID because of what they're doing outside of their jobs and outside of what's going on from their 9 to 5. Is going to the restaurant, going to a party, doing things that are putting themselves at risk, wearing your mask below your nose and not above your nose. So there are different reasons why people, especially those people who are not symptomatic but positive, they're giving it to other people who may end up symptomatic.
Right. And when you say people like get the flu shot and they get sick, is it the flu that made them sick when they get the vaccine? What's happening is you're giving your body a snapshot picture of this is what the flu is going to look like, right? And so then your body goes in and it mounts this response. Part of the side effects of mounting the response can sometimes be the fever, sometimes be the headache. And it's not that it's giving you the flu per se, that you actually have those symptoms. It is the response to it that you are now feeling. And so the goal is that when your body recognizes it the second time, then you have enough memory that it says, oh, wait a minute, that was here 6 months ago. And when that came here, all I had to do was pull out this antibody here and it was gone. So your body then has that memory of it. And so that's the whole goal. But when you get the vaccine, of course, they're going to ask you questions. The one thing that is, if anybody has an EpiPen, those were the biggest reactions. People who had anaphylaxis. Anaphylaxis means that they had a shot, they had exposed to something that caused them such a severe reaction that the vessels close down, so people can become short of breath. They can start wheezing, they can develop hives. And so those people carry an EpiPen. They could have that allergy from peanuts, from shellfish and things like that. So out of now, I think it was 1.8 million people who've gotten the vaccine so far, 21 people had that occur. 17 of them had a previous history of that. The good news is that for the 21 of them, it all occurred in the first 15 minutes. Hence the reason that when you get the vaccine, you are there for a 15-minute window. And for us, even as providers, we know it's the 15-minute window. Let me tell you, during that 15 minutes, people are praying, they're thinking, okay, God, so that's just a normal reaction of who we are. Okay, it's been 15 minutes yet. Whew, okay, thank you, Jesus, And so knowing that, what to expect, is one thing, but I think that's the problem with COVID is because there are so many unknowns, right? But the thing is, we have to harp on the things that are known to equip us with what we need to do to get through this window.
Thank you. Now there's one question in the Q&A. What's the chance of contracting COVID now than it was a year ago? How does it look now versus a year ago when we first started this pandemic?
Mia, you want to answer that one because it is a lot more easy to catch it now than it was. But go ahead, Mia.
So yeah, so like we said earlier, the importance of wearing your mask, social distancing, there was a lot of older people that caught it in the beginning, but now we're seeing a lot of younger people, and that's because of, not maintaining the social distance and not wearing the mask. So it hasn't necessarily gotten any more contagious. It's just, it is contagious. And if you don't do the things that are recommended by the CDC, then your chances of contracting COVID are high. So we want to make sure that we just continue to follow the rules and regulations as we roll out the vaccine, as we, try to reach that herd immunity. We want to still err on being cautious and follow the rules.
Right, because two things has happened, right? Time. It's almost a year. People are tired. So because people are tired, right, and they need to get out a little bit, and especially in places like, Chicago, Minnesota, where it's colder, people tend to get together more indoors because they can't outdoors, and they get laxed, right? The other thing to that is that the new strain, we know, tends to be even more virulent as far as being able to catch it sooner, because there are people with the contract tracing, on the East Coast, and I think out in the West Coast. San Diego had 4 cases. They hadn't traveled, they hadn't been any place, with other people, and they can't figure out the rhyme or reason how they were able, and all of them were under 30 years old, I believe. The issue, though, is that you don't have enough time yet or enough resources that we'll really put in to do contract tracing, to really go back. And contract tracing is when you really sit down and you map out where they've been, how they got exposed, and what happened. So because we're lax right now, because the new strain is easier to get, those are all things that make us viable for picking this up even more. And people don't want to wear the mask over their nose because they still need to breathe. So there's so many people, like, they're afraid to come to the doctor. And I said, well, listen, if you realize when you come to the doctor, we all have on PPE for the most part. Everybody else doesn't have that, right? So a lot of us wear the face shields and anything in the clinical area, or you have glasses. But it is really, really being mindful right now, because when you're tired, when your diet isn't the way it is, you're not haven't been exercising, all of those things begin to put you more at risk for going at COVID, for getting COVID.
Thank you so much, Dr. Green. Thank you so much, Dr. LaVerne Burns. Thank you, Mia Cross, and thank you, Jasmine Hall, and everyone who attended this informational session. I really hope that it was something that was said, question that was answered that gave more light. And we just put up our final poll, just to kind of see what you think about this and was it helpful. And had to change your mind about the vaccine and what have you, but we did want to expose you to information because information is power and is knowledge. And we need to know, we need to make informed decisions as we move on with our life and as we try to get through this entire pandemic. So with that, again, I will say thank you, and I'm going to allow Pastor to close us out at this time. And that's it for me.
Thank you, Suzette, for just being a great hostess in this, and your webinar skills are just going through the roof. I want to thank all of our panelists for being a part today. Dr. Green, so good to see you. I've been knowing her all my life. She is just she's fascinating to me. Thank you so much. I wanted to just let everybody know that that as we have heard this, now we just need to ask God for wisdom on what to do. And that's what it's all about. Taking our knowledge and then being led the right way to make the right decision for ourselves. Thank you so much. Hope Nation, for those of us who want to know more about it, we will be sharing testing. I have gotten testing sites, and I'm involved in possibly vaccination in the real near future. So if you could, every Sunday I'll be letting you know where testing will be taking place, and hopefully vaccinations very soon. And so thank you guys so much for attending. Let's just end in a word of prayer. Dear Heavenly Father, we thank you and we praise you for this opportunity. Thank you for these panelists that were just full of knowledge and understanding, and you could hear their heart. Thank you for letting us know that there are people in the health field that truly care about people. Ask that you would continue to cover them and their family. Now, God, we're asking for wisdom and grace. And God, as we're hearing those who have COVID and those who have are fearful or didn't understand, we all want to thank you for how you have brought us through to this day. Give us strength, give us grace, and just continue to keep us in the palm of your hands. We thank you in Jesus' name. Amen.
Amen. Amen. Thank you so much. And I would like to thank Bernice Porter, Roy Harris, Keisha James, and Maurice LaFair for their transparency, and they're sharing their experience and their walk through this whole virus. So thank you all as well. And with that, this concludes our webinar and our COVID conversation. And everyone go and be blessed. Thank you.